So your doctor has asked you to have a look at this presentation on Achilles tendon problems. As in all of these things, I think you'll better understand the problem if you understand a bit of the anatomy. So let's have a look at some anatomical diagrams of the Achilles tendon. You can see that there are two different muscles tying into the Achilles tendon and tying those muscles into the heel bone or calcaneum. Achilles tendon problems can occur at two levels: lower down at the insertion and then higher up in the mid-substance of the tendon, and that is more usual. Achilles tendon problems usually start off as pain in the Achilles tendon, that's between the calf muscle and the heel itself, and is usually in the substance of the tendon, so well above the heel. Rarely you get problems at the insertion of the Achilles tendon into the heel with associated swelling and stiffness. And if that's the case, then it may be a condition called Achilles tendonitis related to something like psoriasis or ankylosing spondylitis. So if that happens on one side or both sides, or it recurs, maybe the diagnosis should be reviewed, that it may not be just a mechanical problem and it may be part of a more generalized problem. In the mid-substance of the tendon, you'll frequently find pain with some stiffness or tightness in the calf and the tendon in the morning time, and it loosens out after a while. And if you are calm and quiet as regard to your walking during the day, there's no problem. But if you get up from sitting down, it may be tight for a few steps and then it's okay again. But if you run or walk for too long, then you can provoke more pain again. And that's due to wear or degeneration in the tendon. It's sore to touch. Sometimes with more severe cases, you can feel a nodule or a swelling in the Achilles tendon. So in some Achilles tendon problems due to degenerative disease or wear or overuse, one can, with some stretching and strengthening exercises, improve matters, sometimes resolve the situation, and you can resume your activity. You can reduce the activity, reduce the level of activity until such time as it heals up. And the healing will be helped and speeded by stretching and strengthening program. And it's fairly simple. So I'll just show you the stretching exercise you can do. Here's an exercise to stretch the Achilles tendon, in this case the right Achilles tendon. So put the left foot forward and bend their left knee, put the hands up against the wall in a position adopted as if to push down the wall. Keep the right knee straight and the heel on the ground, and push, hold for about 10 seconds, relax for 5 seconds, and repeat that 10-15 times twice daily. You'll feel the tightness in the calf and upper Achilles tendon when you do this. I'll show you in a different plane now. Keeping the forward foot on the ground, bend the knee, and with the left foot with the heel on the ground, keep the knee straight and lean in, pressing against the wall. Later on, one can stretch the lower parts of the Achilles tendon by bending the right knee slightly as one is doing the stretch. Now those stretches are fairly easy and should be undertaken every morning before you do your strengthening exercises, and certainly before you undertake any running or walking activity. The strengthening exercises again are fairly simple, and these you can do at home. Here's a technique for strengthening the calf muscles. Take a small height, in this case 2 telephone books, put the toes on the books and then raise the heel off the ground. And you can do it on alternate legs, and then you lift and hold off the ground for about 10 seconds and then repeat on the other side. Now this is very safe and easy and a good way to start off calf strengthening exercises. Once it gets easier, one can use a step ladder, or more usefully the last step of the stairs, using the wall for security. Lift the foot up and then let it down below the level of the step, and do this on alternate sides, and just lift up and hold for 10 seconds and relax. And this is both stretching and strengthening the calf. And doing those twice a day until such time as things improve, and then once a day long after your symptoms have settled down, and treating both Achilles tendons should go a long way towards preventing recurrence. If you do that, then hopefully you'll get back to the previous level of activity. If in spite of the exercises you continue to be very symptomatic or get worse, then you should go back to your doctor, revisit the diagnosis. He may want to send you to see somebody else with more expertise and have some specialized treatment. You should expect with Achilles tendonitis, in most cases, to get better and to resume full activity.